Okay, start.
Hello, good afternoon. I
Good
am
afternoon,
Fatima.
doctor.
I am Fatima, the covering doctor today. I think you are Hina, right?
Yes.
Would you please, Hina, confirm your full name and age for me again?
My name is Henna. You can call me Henna, and I'm 34 years old.
Hello, Hina. Nice to meet you again. So I believe that we are here to discuss things regarding your cyst, which is suffering behind your knee, right?
Yes, doctor.
Okay, Hina. Um, do you have any symptoms, new symptoms? Anything's bothering you?
No, doctor, there is not anything else. It's the same, doctor, the big persist, which,
Mhm.
assist on the back of my knee for a few months.
I
And
see.
yes, and you just told me to observe it for a few months. And,
Okay,
but you know what, doctor, I think that, the cyst, it looks larger. And
I
as you know that I am a dancer, so as a dancer, it affects my
mhm.
performance.
Uh-huh.
Yeah, so that's why, doctor.
Uh-huh. I understand your worries, Hina. First of all, would you let me to examine you?
Yes, doctor.
Okay. So after examining the cyst, it seems for me that there is no change in its size, I'm afraid. And as you said that you are not suffering any new symptoms, I would like to tell you that your condition never changed and this is the same size as there is no new symptoms. I would like to encourage you to continue the same treatment, the previous treatment which we have discussed previously. Things like doing physiotherapy and wearing the supportive footwear, and you can do some ice compresses. Does that make sense?
Yes, doctor. Okay, so but I think so, doctor, the size has increased, and if the size will increase more, so it will affect my performance, as I just told you. So,
Mhm,
can you just recommend me anything, doctor? I'm already doing this physiotherapy, ice, and supportive
mhm,
footwear, but it isn't
mhm,
working for me. I just
mhm,
want to know any other treatment options.
mhm. I completely understand your worries, Hina. Let me reassure you that as things now are doing good and there is no any worsening features or progressing signs to the bad things, in the future, if this happens, I'm gonna refer you to the sport physician or an orthopedic surgeon which will can deal with the things eventually that time. Does that make sense? Are you hearing are you hearing me well, Hina?
Yes, doctor.
Okay. So in the future, if anything's happen or any changes happen or any increase or decrease in the size, I'm gonna refer you to a specialist who will gonna deal with things eventually. Do you have any other concerns?
No, doctor.
Okay, Hina, I believe that we have discussed things regarding to your Baker cyst which behind your knee. And after examination, it seems that there is no change in the size. And as you said, there is no new symptoms. I'm gonna give you a review in a 3 months to come and see me. And if anything's happened before that, you can let me know and you can come here whenever you need. Does that make sense?
Yes, doctor.
Okay. Do you have any unanswered questions?
No, doctor.
Okay, Hina. Um, so this is my number. You can contact me freely before this 3 months, and your review will gonna be in 3 months. Is it okay?
Yes, doctor.
Okay. I wish you a quick recovery, and thank you for coming to see me today.
Thank you, doctor.
Bye bye, Hina.
Thank you. Okay, so another one was Morshida, you want to start?
Yeah, yeah.
Okay, start.
Okay. I think this could be a review visit. In that case, so how I can address you?
You can call me
Hina,
Alexander. Yes, okay, Hina.
Alexander. Okay, okay, sorry. Uh, uh, Hina, okay, Hina. Okay.
Yes.
So, uh, so I am now going to start. Okay. Um, Hello, good evening, Hina.
Good evening, doctor.
How you feel still? How you feel till?
Um, it's the same, doctor. I'm just worried that
Mm-hmm.
my cyst has increased in size.
Mm-hmm. Okay. So I just happy to again meet with you. But here for just recap, I want to do some recap with you that you came here few months ago and we make a diagnosis of Becker cyst. Is it right?
Yes.
Okay. So before going into deep, just I want to examine you. Is it
Okay,
okay?
doctor. Yes,
Okay.
doctor.
So yeah. So Hina, please, can you please tell me about your pain, how it is?
Doctor, the pain is still the same.
Okay. And what about your movement?
It's the same, doctor. As you know, the condition is same as it was
Mm-hmm.
before. And you know that I am a
Okay, okay.
dancer, so it's just affecting my performance, doctor.
Okay, I'm really very sorry to hear. It must be very difficult for you. But what I observed that from examination, the cyst size is same as before. And also you didn't mention anything new complaints. So here I just want to say that we can continue to observe the cyst. Is it make sense to you?
Yes, doctor, but I'm
Hello.
already, doing the same. So I just wanted to know anything else you can do because I believe that it has increased in size.
I can understand that you are very much worried, but here I think if we can continue the current treatment that I asked you previously, like physiotherapy, ice compression, and also supportive footwear will help you. And at this condition, I just believe that continuation of treatment will be the best. Uh, can you follow me?
Yes, doctor.
Okay. So do you want to know anything more?
No, doctor. I just
Okay.
wanted to know
So
that any other treatment options apart from observation or this, which you have already told me.
okay, I can understand that it's a very difficult situation for you, but we here uh, for your best for your best future. I want to continue treatment as well as in future we can arrange some review visit with a sports physician. And also, we can refer you to orthopedic surgeon or a knee arthroscopy to evaluate your or treatment of underlying injury. Is there any degenerative changes? Is there or not? Is it make sense to you?
Yes, doctor.
And also, here I want to make a review visit within 3 months to see how the things is progressed.
Oh, okay, doctor.
Okay, so if you agree, I can make a quick summary for better understanding.
Okay, doctor.
So today you came to me with your previous diagnosis, that is Becker's cyst, and you said the cyst is enlarging in size, but here with the examination findings and based on your symptoms, you said it's revealed that it's just same as before. So here we just want to observe and also make some plans for future treatment and make and advised you to review visit within 3 months. So here I just wish you rapid recovery. Thank you. Nina.
Thank you, doctor. Okay. Okay. The last girl was Zarnab. Are you online, Zarnab?
Sorry.
I
Yes, I'm
will just,
online.
yes. Shall
Can
we
you?
start, Zarnab? Yes.
Mhm.
We gonna start?
Yes, start,
I
please.
can. Okay, so मेरा कार्ड कौन सा है?
यही same card है.
ठीक. I have just joined. I haven't read it, so can I have a few minutes for reading it?
Okay.
So your own.
Meanwhile, if anyone else want to do the card, just let me know.
Can I do it?
Have you prepared it?
Yeah, I can do it right now.
Okay. What's your name?
Madiha.
Okay, start.
Okay. Start.
Yes.
Hello, good morning. My name is Dr. Madiha, and I'm your doctor in duty today. May I know your name in it, please?
My name is Hannah and I'm 34-year-old.
Okay. How would you like to be addressed?
You can call me Hannah.
Nice to meet you, Hina. So, Hina, I understand that you are having some Baker cyst at the back of your knee. Is that correct?
Yes, doctor.
Okay. So, Hina, can you tell me, like, how are you feeling today?
It's, my condition is the same and I'm
Mm-hmm.
feeling good. But I believe that the size of the cyst has increased
Mm-hmm. Okay. And what made you think about that your size has been increased?
because I'm looking at it.
Mm-hmm. Okay. So
Yeah.
before commenting on that, can I ask you a few questions regarding your condition? Is that
Yes,
okay?
doctor. Yes.
So, from the previous visit, have you noticed any new symptoms yet? Like any pain in the knee or any, difficulty in movement?
Well, doctor, there is no pain, but yes, there is some kind of a difficulty in movement. And, as I'm a dancer, it's affecting my performance.
I'm so sorry to hear that, Hina. That must be difficult for you. And I assure you that whatever I can do for you for this cyst, I will definitely do it. Okay?
Yes, doctor.
Mhm. So, after doing physical examination, it doesn't seem that this cyst has increased in the size because we have measured it at your previous visit as well, and I've measured it today, and it's the same in the size. So, I would like to encourage you to continue the same management that you were doing today. I believe that you were doing physiotherapy and putting some ice on it, and you were also wearing some supportive footwear. Is that correct?
Yes, doctor. But as you know that, I believe I'm already doing all these things. And
Mm-hmm.
I'm a dancer, and the cyst is affecting my performance, and I have a busy schedule. I cannot come to the clinic again and again. So I just want to
Mm-hmm.
know any other treatment options, doctor.
So, uh, so for now, this is your best shot that we are doing today. At this moment, we cannot, intervene in this cyst because it seems benign to us. And if we do something that rather than doing some advantage, it might, do some damage to your knee. But I have a plan. If the cyst remains same for maybe in the next 3 months, then I would definitely refer you to a specialist, orthopedic surgeon, or I would like to do some other investigation, for example, knee arthroscopy, to evaluate your further condition, and we'll look for it if there is any degenerative changes happening in your knee. But if I would refer you at this time, I think the orthopedic surgeon would do the same because there is no recommendation of doing any intervention at this moment. Are you following me what I'm saying?
Yes, doctor.
Okay. Do you have any questions so far, whatever we have discussed?
No, doctor.
Okay. So thank you so much for your understanding. I would like to set up a review with you in the next 3 months, and I would like to see if there is any new symptoms has been developed, or and I'm really hopeful that after that, within 3 months, this cyst will resolve by its now. But if it's not resolved, I have discussed with you the plan, and we will stick to the plan and we'll do whatever we can do for you. And in the meanwhile, if you think that the size is increasing and you cannot move your leg and the pain is becoming severe, then you can come to me at any time. Are you getting my
Well,
point?
yes, doctor.
Any further questions, Hina?
No, doctor.
Okay, thank you so much. Time's done or not?
Yes. Okay.
Oh, thank
Zarnab, are you ready?
Yep.
Okay, then start, please.
Hello. Uh, I am Dr. Zainab. I'm your treating physician for today. Um, how can I help you?
Well, doctor, I'm here for my Baker cyst. You just told me to observe it, but I think that, the size of the cyst has been increased. And you know that I am a dancer, so it's affecting my performance, doctor. That is why I'm here.
Yeah, I can understand that it is affecting your performance, and it's really important that you don't have such problems while doing whatever you want to. But observation is really important for that. That's why that was prescribed to you. But if you feel that the size is increasing, and you think that you need some other treatments, like then we can have a review about that. But what I think is that what I have seen is that size is about same. It's just because you have been observing it because you are having problems with your performances. That's why you are, I think, more observant about that. Any new symptoms have you observed so far, like pain or reduced movements, which is hindering your movements? Like, can you please describe that?
Well, doctor, there is not such pain, but yes, the movement is compromised, and I'm just feeling difficulty in dancing, doctor.
Yeah, I can understand that. But I would recommend that you continue with observations. Since there is no symptoms and it's not increasing, if we go with any intervention, it might cause more damage than benefit. So I think that we should continue with doing the physiotherapy and ice and supportive footwear. If you follow that, then the things will go better.
Well, doctor, I do not have time to come again and again to the clinic because I have a very busy schedule. So can you just, you know, highlight some other treatment options that can help me?
Yeah, sure. You have other treatment options as well. We can have a review by sports physician. Orthopedic surgeon can also review you. The knee arthroscopy is also there to reevaluate and treat underlying injury. But um, these are the options when we don't get benefit from the supportive treatment, the physiotherapy and ice, which I've already told you.
Okay,
So,
doctor.
are you getting my point?
Yes.
Yeah, just if you have any other question, can you please ask?
No, doctor.
Well, so far what we have, you came with the Baker's cyst, which in your belief was increasing in size, but I think that you should better observe it, and after about 3 months, we'll review it. Since then, you should continue with the supportive treatment, and I hope that this would benefit you. Is it okay?
Okay, doctor.
Okay. Thank you for your visit.
Yeah. Okay, I will start commenting. I would say that all four of you, didn't make a good introduction and you all of you didn't concluded on at a good note. The introduction was not correct. Although I am a follow-up patient, okay, if I would just start with Fatma, there was no empathy, introduction was not proper, and you were just repeating makes sense, makes sense, makes sense, which is not a good sign, which is not a good sentence, that you're just asking the patient that, okay, fine, if I'm just making a sense, like if I'm just a stupid person that my talks are not making something, or my conversation is not of that point, and you just asking the patient, you're asking for seeking the validity, okay, fine, if I'm making any sense. And in the end, you said, okay, any answers and questions, then the conclusion was also not the, you didn't conclude it properly. And Moshida also, introduction was not good. There were a lot of grammatical mistakes. I think so. You should work on your grammatical mistakes. And I will just quickly recap and this that. You recap. You can do it a bit earlier, or you can just paraphrase the word recap and put in a very good sentence. And again, you also said make sense. So that was also not good. And conclusion, it was okay, but not that perfect. Zarnab, your introduction was not good. And meanwhile, soon after the introduction, you were giving some kind of explanation that was very irrelevant, and that was, to be very honest, that was not making sense at all. I was unable to understand that what you are trying to say, like what you wanted to inform me, or what you were trying to tell me. Okay, and new symptoms, you should, you asked about the new symptoms later. You should have asked that before. Okay, again, the conclusion was not good. And if Madiha, your introduction was also not proper. It was not good. What made you think increase in size? You will not ask like question like, if I'm telling you that it has increased in size, then this question is irrelevant. Okay, yes, it's irrelevant, because the patient is, uh, this is your, okay. And then may I ask you questions? It was good that you at least you asked for the history and you asked the questions, but you should have asked it before, and the conclusion would have been more better than yours. Okay, so these kind of questions, I would always say that OET is the exam for English. It's not about testing your medical knowledge. Okay, so in OET, they seek that you just go in a sequence. As I just shared the video yesterday, it was mentioned in that video as well that you have to go in a sequence, arrange your card, and then perform your card. Okay, introduction. Although I'm your follow-up patient and I'm coming you after a few minutes, few months or few weeks, after whatever time, so you can greet me properly. Hello, Miss Henna. Nice to see you again. As you already know, I'm Dr. Henna, one of the treating physicians in the suburban clinic or whatever the setting is. Okay, so this is your, I believe this is your follow-up visit. Am I right? Then I will say yes. Okay, so you have been diagnosed with Baker's cyst when you just visited me last time. Is that correct? Then yeah, I will say cyst. So as you know that, okay, fine, whatever if it required, then you explain the, this Baker's cyst. So you can say, okay, before we proceed further or whatever, okay, now the card starts with the patient. If the patient say, okay, fine, doctor, you know what, I think my size has increased or this, that. Okay, I appreciate your concern, Miss Hannah. Before I, before I proceed further, may I just ask you some questions to understand your condition better? Then you will take a proper history. You will say, okay, is there any pain? Okay, are you experiencing any reduced movement? Okay, is there any swelling or whatever you want, a tenderness or redness? Anything you can just ask. Is it affecting your performance, or is, whatever you want to ask, you will ask. After that, you will just thank the patient. Okay, thank you for answering my questions. Now, if you do not mind, can I just examine your cyst? Okay, and if the patient says that, okay, fine, it's a painful cyst, then you can also add a line, okay, I will be as gentle as possible, and if there is any pain, just let me know. This shows the empathy, and all four of you were lacking empathy. You were lacking a rapport, a patient building relationship, that you were lacking. And OET is all about that, because they are giving you everything written in front of you. Then they require also something from you, from your side, and that is, this empathy and everything that you have to fill in the gaps to perform the card. So okay, then, okay, thank you for letting me do the examination. And then again, okay, explain that you want to, okay. Okay, well, no symptoms or enlargement. Okay, Ms. Henna, I would like to inform you that there is no change in size of the cyst. Then if I will argue, then you will say, I understand, Peter, Ms. Henna, that you think that your cyst has been increased, but I have measured it and it's of the same size as it was before. So there is no increase in the size of your cyst. And if there are any associated symptoms, so uh, if I just have told you that, okay, fine, there are no associated symptoms, then you also, okay, then I will, I will inform, I would like you to continue the treatment that we are already doing, that is the physiotherapy, along with, icing and, wear supportive footwear. So this what, and then I said, okay, I have a busy schedule or something like that. And you will say, okay, I understand your worries, Miss Henna, and I can see that you have a busy schedule, but for the treatment that I have already informed you is the first line treatment to resolve this Baker cyst. It's a popliteal cyst on the back of your knee, and most of the time it regresses with time. And most of the moment, yeah, most of the time it just regress with regress with time, and there are no such treatment needed. But in case if it does not reduce in size or cause any symptoms, then I will just refer you to a sport physician or an orthopedic surgeon, and review by sport and a knee arthroscopy to evaluate underlying injury or drainage. And yes, and I will also advise a knee arthroscopy through which we can evaluate if there is any underlying injury or any degenerative changes has taken place or not. So how does this sound to you? How do you feel about this? Then I will say, okay, fine. I'm glad, Ms. Henna, that you have agreed to my suggestion. So I would suggest a review in 3 months time, and we will just assess your condition at that moment. And if needed, then I will just refer you to a physician, or or we will just do what I have just stated above, that is arthroscopy and referral to a sport physician or this and that. And do you have any further questions? Do you have any further concerns? Oh my God. Okay, I will say no. Okay, here is a leaflet which contains all the information about Baker cyst and how it's resolved, yeah, how it is managed conservatively, and yes, conservatively that it will come, because the card is about, at the moment the card is about conservation. Okay, conservatively, so you can just take this and read it back, and if you have any further concerns, you can contact me or visit the clinic anytime. I wish you a speedy recovery. Have a nice day. Thank you. Bye. So this is the proper way to include the card, and the introduction should be also proper. Even the patient is your follow-up patient, you will ask, okay, fine, take care, okay, you are here because this is, you will not start and saying, okay, fine, you are having Baker cyst and you are doing this, and okay, fine, you are doing this, are you having new symptoms? And whenever you are asking about the new symptoms, just ask one symptom at a time. Okay, it's not like, okay, fine, take care, are you experiencing a new symptoms? No, it's in OET, it's not always that you just pick up the line straight. No, you have to paraphrase that. You have to make it fancy. You will not just read the exact lines written on the card. No, you will not get points in that. If you're going, if you're doing this, you will never get points. If you want to get extra points, if you want more points, then it's better to paraphrase the sentences. Ask in your own words instead of reading the same sentences. But if you think that you are unable to do so, then yes, you can read, but above and below you have to just put in some other sentences, stitch in some other sentences, so it makes a proper sentence or a paragraph. So, and in all of all of you just made the same mistake introduction, you will just get confused. Okay, fine, this is the follow-up patient, so you know everything. And in the first also, I think so Fatima and Mushida, you will just, okay, may I just confirm your name and age, please, and how may I address you? No, you already know your patient, because the patient is your follow-up patient. And when you are asking me the question, my name in, while you are preparing the cards, and what's the point of, again, the confirmation? No, that you will do in PLAB. Okay, fine. Okay, just for the case, I just want to record, or I just want to confirm your name and age, please. Or could you please tell me your name and age, please? Again, this is for the record. No, no. In OET, you will not do that. You should show your empathy, organize your letter card Just understand the scenario, use the maximum information, and then proceed. Anyone has any
Okay.
question?
Thank you so much. That was so informative, Dr. Hina. Thank you.
Welcome. So anyone has any question?
Dr. Hina,
Mm.
like it's a review visit.
Mm.
So in that case, you want to say introduction was not appropriate.
Yes.
Actually, like I asked before that your name and started with as a old. So it's a second case. So what other things? Maybe some things I missed because my poor network. So can you please repeat, or I get any recording for this?
I will share the
Actually, I
recording in the
missed
group.
some.
Okay, I
Okay,
will share the
okay,
recording
okay.
in the group. Your introduction was not
Mhm.
proper, and you were having a lot of grammatical mistakes. You should work on your
Yeah, yeah.
grammar and avoid this sentence. Okay, it fine. It make any sense? Are you following me? Are you with me? How does this sound to you? Is that okay with you? Can you do this? You will ask like this question, and you said, okay, fine.
Okay, okay.
Recap. I myself, I'm saying that okay, fine. I'm having a baker cyst, and then what do you want to recap? I told you that okay, I'm having this. My cyst has increased in size, and then you were like, okay, fine, I will recap it again. No, you will not recap that. If if I
Okay.
have already given you the information, then there is no need of recap.
Yeah, yeah. Understand. Okay. Thank you. Thank you for your
You're
nice
welcome.
comment.
Okay. I will share in the group, or I will just make a video or share that the template also. But whoever's written the chat, there is no such template. You have to. I would say that okay, I will share the template.